Hi, this is Dr. Murray with Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video here for you today on two topics, one on omega-3 breakthroughs, and also your muscle is a metabolic organ. Two important things to talk about, just getting some of this information from the media and some of the stories and research that's come out here recently. And these articles are almost always published also copied on our Facebook page. So go ahead and check out that information on there as well. In particular, on the first study I'm talking about here, which is the omega-3 breakthrough study just came out here, and this is from the New England Journal of Medicine. It's talking about fish oil, the omega-3 fatty acids. It says that fish oil cuts heart attack and stroke by 43% in those that have dialysis or needing dialysis, a kidney disorder. That's pretty significant. They looked at a fairly large population of dialysis patients and showed that those who were using fish oil, they actually reduced their heart attack and strokes by 43%. Huge thing. Now, why would that be the case? Well, if I ask anybody around in our community here, and you say, how much fish are you consuming? Hardly anybody in the Midwest is consuming fish on a regular basis. The American Heart Association has recommended that at least eating 2 servings of fish a week. But also then you start talking about the quality of fish. A lot of people are low in the omega-3 fatty acids. Remember, the omega-3 fatty acids are called essential fatty acids. So if you're not getting this omega-3 fatty acid in your diet, then you are deficient. You're low in it. There are lots of people that are low in omega-3s, but they're not deficient in Tylenol. They're not deficient in Crestor or Lipitor or statin medications. And they're not deficient in a whole host of other medications, but they are low in omega-3s. The EPA portion of that fish oil is anti-inflammatory. It helps to reduce inflammation. In this case, in the study, it helps to reduce the inflammation that can come from a heart attack or from a stroke. But also, that's the EPA portion, which is anti-inflammatory. The DHA part is important, and well, it's actually essential for cognitive function and supports your brain, your serotonin levels, your dopamine levels. If you go right now and you go to Walmart and you look at a can of infant formula and you roll that to the back, you'll notice that it's fortified with DHA, which is an essential fatty acid for the brain. And that's why it's not just important for you and I as adults, but also for children. The American Heart Association, they acknowledge that the omega-3 fatty acids, that they actually help with arrhythmias. They help decrease plaquing in the arteries, which again, if you go back to our stroke and heart attack related study there, it's important for the sake of those things. Also helping reducing blood pressure, and also helping with triglycerides. You can actually purchase omega-3 fatty acids in a prescription form that is FDA approved with helping with triglycerides, which the American Heart Association, they acknowledge it helps with triglycerides. So the omega-3s are 100% good things for us to have. But another study that's come out here in the last couple of years has started to highlight the reality that sometimes your omega-3 fatty acids can cause AFib or atrial fibrillation. So that's a little bit more nuanced because some people are taking a bunch of omega-3 fatty acids and they don't need it. But you should take as much oil or omega-3 oil or nutrient or supplement that your body needs. And some people do not need more omega-3s, and it could be detrimental if you're taking too much. That's why I always say not to test is to guess, but to test is to know. Who has made some type of recommendation, medical doctor, natural physician, your neighbor next door, and said, hey, you should be taking some fish oil? All right, great. It's probably not going to hurt anybody to take a little bit of that, taking 1,000 milligrams. But what if you are already taking in enough? Well, you should test. You should find out whether or not you're too low. And also, if you've been taking it for a period of time, is it enough? Honestly, it's an essential fat. You have to have it from your diet. And if you're not getting your diet, you're low. Why don't we test for that? And we know it helps with helping to reduce heart attack and heart complications and helping with inflammation and triglycerides and all these things. That's something that we really should be doing at every one of our wellness visits, is checking the omega-3 fatty acids. And when you're checking the omega-3s, you can always hand in hand concurrently check the omega-6 fatty acids. The omega-6 fatty acids, we get a lot of those in our diet, and those are never tested for either. And we get a lot of those, and the omega-6s tend to drive up inflammation, all the seed oils, if you may. So it's an important thing for us to have those omega-3s tested. It's also important to note that there's a multitude of studies out there showing that your omega-3s do help to prevent a variety of inflammatory conditions and reactions in your body, and the DHA part also can be good for your brain. It's important to have it tested. So great study there. The next topic, if you've looked on some of the trending kind of news articles out there, is one is your muscle is a metabolic organ. And that is definitely true. Your muscle is a metabolic organ. In other words, your muscle helps to maintain the metabolism of your whole body. When people come in and they say, I think I'm having trouble with my metabolism, what most people think when they think about metabolism is they think about, well, my thyroid is off or my sex hormones are off, because those things affect your metabolism, your ability to heal, repair, and self-regulate, and yes, lose weight and gain weight. Because that's what most people start to think of when they say metabolism. They start to think about losing weight or gaining weight. But really, metabolism encompasses everything that your body needs to do to function correctly and be balanced in how it's going out throughout life, which is healing, repairing, and self-regulating. Yes, losing weight and gaining weight. So your muscle is also one of those major contributors to metabolism. When I speak to patients about their metabolism, I always say this: your metabolism is predicated on not just two areas, not just your thyroid and your sex hormones, but also on your muscles. Your muscles dictate also metabolism. And that's why this expression that's out there saying that your muscle is a metabolic organ is 100% true. That if your muscles are not working correctly, if they're not being fed correctly, if they're not being oxygenated effectively, if they're not being given water and hydrated effectively, then they will not be able to function optimally and your metabolism will be affected. Look what happens as a person ages. As a person ages, their muscles tend to get smaller. As your muscles get smaller, that's also when a lot of people tend to have either problems losing weight, or they also have problems in metabolizing glucose or sugar. So yeah, your muscles, we need to pay attention to muscles. And there is a condition called sarcopenia that is basically age-related muscle loss, progressive muscle and bone loss and strength that can occur as a person ages, where their muscles are basically wasting away. They're eating in calories, they're getting in calories, they're eating, but they're wasting away, their muscle is decreasing. And then what happens? Their metabolism changes because your muscles is a metabolic organ, right? So it's important for us to be mindful, especially of geriatric patients, watching their muscle mass and supporting their muscles so their muscles can do the metabolic work it needs to do. 100% we need to look at a person's sex hormones. 100% we need to look at a person's thyroid function. But we also need to look at the muscles and ask the question, why isn't this functioning like it used to? Why isn't it metabolizing like it used to? Why isn't it burning calories like it used to? Is it possible that a person's oxygen status is low? And it's affecting your muscles? Is it possible that your muscle mass just in general, you're more sedentary, so your muscles are starting to waste away in a sense because you're not actually building muscle like you used to? This could certainly be the case, and that's why exercise, strength training is all important to do. Could it also be because you are not absorbing proteins effectively? That's one of the problems with sarcopenia, or this age-related progressive loss of muscle and strength and stamina, is that you may be getting in protein, but you may not be assimilating it and tearing it down effectively. So yes, some people will benefit by doing some type of either protein supplementation or a medical protein supplementation that is kind of broke down more and easier to digest. But perhaps some people also need to be doing some things that help them to digest their foods more efficiently so they can absorb the proteins and absorb all those nutrients that they want to, but they aren't because things have slowed down. Their muscle mass has decreased and probably their digestion has changed, and so they're not absorbing those nutrients effectively. So you can test, of course, and you can see what the status is of your absorption. We can test and see what your protein status is, what your nutrient status is, what your vitamin nutrients are, of course, what your omega-3s are. All those work hand in hand. And then we can also, you can do some testing. You can see what your oxygen status is, whether that's at night or throughout the day. So it's important to get to the root cause of problems. And when people are having metabolic problems, metabolism issues, we shouldn't just all of a sudden just say, you know what, I guess I'm just getting old. Or, you know what, it's just my thyroid. It could be some of those things, but it might be something a little more occult, a little more hidden, a little bit more difficult to understand. And sometimes you need to do the testing to figure out what's actually going on in the body. And that's what we do through our comprehensive 60-point analysis, nutrition analysis, looking at nutrients, looking at foods, looking at hormones, looking at a variety of factors so we can give the body what it needs and take away what it doesn't need so the body's better able to heal, repair, and self-regulate. Hey, listen, everything we've talked about here, first, talk it over with your health provider first. But if you're not doing some exercise, you need to be doing some exercise. If you're eating too many carbs and sugars, please, we should be reducing those. I think most people already know that. But past that, if you're really wanting to figure out what's going on with your system, why isn't it working, give our office a call. This is Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.